Complication of diabetes mellitus. As a result, uncontrolled hyperanemia for the long time in diabetes mellitus, almost all the organs of the body undergo biochemical and structural alternation, which lead to major complications like diabetes ketoacidosis. It is usually developed in the patient with severe insulin deficiency along with the excess of glycogen. This severe lack of insulin causes lipolysis in the adipose tissue, resulting in the release of free fatty acid. These free fatty acids are taken up by liver, where they are oxidized into ketones body. When this rate of ketoacidosis exceeds the rate at which it can be utilized by muscles and other tissue, then it leads to systemic metabolic ketoacidosis. Atherosclerosis. Both type 1 and type 2 diabetes mellitus patients are prone to develop atherosclerosis. The cause of accelerated atherosclerotic process is diabetic mellitus patient. It is due to reduced HDP, hyperlipidemia, obesity associated hypertension. Diabetic nephropathy. Renal complication is diabetic patient. It is one of the leading cause of death in them. Following renal lesions are usually seen in diabetic patients. Microalbuminuria, diabetic glomerulosclerosis, diabetic polymorphic renal edema, diabetic retinopathy. Diabetic retinopathy is one of the leading muscle of preventable blindness. It is characterized by development of microaneurysm. It is renal capillary associated with muscular edema. Diabetes also predisposes the patient to early development of cataract and glaucoma. Diabetic neuropathy. Diabetic neuropathy may affect CNS as well as peripheral neuropathy. The neuralgia complications are usually seen in the patient due to Schwann cell injuries. Axonal damage. Diabetic macroangiopathy. It is characterized by basement membrane thickness of a small blood vessel, capillary of the skin, skeletal muscle, eye, kidney, etc. Infection. Uncontrolled diabetes lead to impaired leukocytosis function, reduced cellular immunity, microvascular changes, and hyperglycemia. Diabetes patterns are more susceptible various infections like tuberculosis, pneumonia, polynephritis, otitis, etc. Diabetic foot complication. The microvascular and neuropathic changes in the foot of patient with uncontrolled diabetes may lead to ulceration, infection, and gangrene of the foot.